There's water right here. Oh, okay.
All right, here we go.
Well, hey, everybody. Come on into the Rooted in Progress Stream Center.
Welcome back, everybody.
How you feeling, Terrence?
I'm feeling good, man. I feel really, really good on this beautiful day.
Yeah. It feels
Thursday.
like fall for the first time. And it's
Not quite. I
mid-November.
can feel it. It's knocking at the door.
Oh,
Yeah, I'm ready for it to open that door up and let it in. 'Cause this humidity and this heat down here in Florida is getting a little bit much.
Yeah.
And I'm not the one to complain, but
That was complaining, though.
yeah. But I'm ready for the break in the weather.
Listen, we have Thanksgiving on the way.
Yes.
Christmas coming.
Let's get through Thanksgiving first.
I know, you're right. Well,
Yeah.
not in my neighborhood. The lights are
Oh
up.
yeah.
All throughout the neighborhood.
People, as soon as Halloween is over with, man, here comes the Christmas trees and all the Christmas lights. So,
Listen.
I'm good.
Well, hey, y'all, thanks for joining us on Rooted in Progress. If you haven't done so already, I don't care what you're doing.
Yeah.
Even if you're driving, do it at a light, though. Do it at a light. We promote safe driving. Make sure you follow us on all of our social media platforms at Rooted in Progress. And be sure to follow us and like us and subscribe, baby. On Spotify, Apple Podcasts, and on YouTube. Y'all know we're here every Thursday at 11 a.m. And today we are talking about diabetes.
Yeah.
It is National Diabetes Awareness Month, and this is something, and diabetes itself is something that truly affects so many people. I believe the most recent statistic was like 32 million people in our country face diabetes, whether it be type 1 or type 2.
In other words, in the Black community, they call it the sugar.
You're right.
You deal with it.
You're right. We've called this sugar in silence.
Baby, we got, your grandmama got the sugar. So
I know.
But diabetes affect pretty much any and everybody.
Yeah.
It runs in my family, type 2. I just got to be careful with what I eat.
Yeah.
My dad right now has type 2 diabetes. And so this is very, very important to me. So, Deanne, you have anybody in your family?
I think my uncle has diabetes, but
Okay.
I'm not too sure how many people have diabetes in my family, which is probably a problem within itself. But I do know it's something, I do have close family friends.
Yeah.
They have a daughter who was recently diagnosed with type 1 diabetes. So it's something that I've actually had to learn about because when she was diagnosed with diabetes, we all had to download an app.
Yeah.
We all had to learn and kind of get on this train of trying to figure out how do you take care, how do you support someone who is facing diabetes, whether it be type 1 or type 2. So it's something that stares us all in the face. So we're going to break everything down.
Well, and I like what you said. You said you all had to download an app.
Yeah.
So we'll dive into what that means and what that looked like a little bit later on the show. But
let's show some love to our guests.
Yeah, let's go ahead and bring our guest in.
We have Dr. Kathryn Syed of Grace Point. She has an incredible background in this medical field. She focuses on community health and has been focusing on community health for years. We appreciate you hanging with us today.
Thank you,
Thanks so much for having me.
Of course. And then we got my girl, Antoinette Watkins. Some of y'all may know her. We did a story together last year for the Culture, but Antoinette Watkins is a type 1 diabetic herself, but more importantly, she has a nonprofit organization called Diabaddie, which is so cute. We're going to talk about how we even got to this name. But Diabaddie organization, where she is actually raising funds and raising awareness about diabetes, particularly in minority youth, and helping them go to diabetes camp and doing all these incredible things. Antoinette, thanks for joining us from
absolutely.
Baltimore.
Thanks for having me.
She's a Tampa Bay girl, though, so make sure, Tampa, y'all show her some love. And so I really want to just get right into this. For Dr. Syed, for folks who don't even know what diabetes is, tell us what diabetes is and the difference of type 1 versus type 2.
So diabetes is a problem where the pancreas is either not secreting enough insulin or the body has had resistance to insulin and the sugar, your glucose starts getting high. So 90% of people with diabetes actually have type 2 diabetes. Type 2 diabetes is much more linked with obesity and genetic predisposition. So, if you have someone in your family, that's a big call that you should be getting screened for that, especially after the age of 45. If you have type 1 diabetes, that actually used to be a death sentence about 100 years ago before insulin was discovered. So do you know why World Diabetes Day is actually today, November 14th?
Tell us.
I thought that was interesting.
Tell us.
I was doing some research. So
educate us.
The Canadian surgeon, Dr. Frederick Banting, he is the doctor that is accredited along with one of his assistants for discovering insulin in 1922, and he actually won the Nobel Peace Prize the following year. Wow. So that, just completely changed the face of medicine. Like, there's so many people that wouldn't be with us. And even though only 10% of diabetics have type 1, there's a much bigger burden on healthcare because they're much more likely to suffer from complications such as kidney failure and, dialysis, foot amputations, blindness. The most common cause of the world of blindness is actually diabetes. Wow. There's so many things linked to it. So if you have type 1 diabetes, that cause is actually not known. It's thought to be something with the immune system being triggered, but your pancreas basically just stops producing insulin. So usually it happens in much younger people, so they have more time in their life for all those complications to start off. And the biggest problem with diabetes is the risk of heart disease. That's actually the most common cause of death of diabetics. So there's so many things, when we look at someone with diabetes or even pre-diabetes, getting them educated of how they can help themselves, there should be much more emphasis on healthy diet and exercise. Yeah. And we hope to get to that and be screened early before needing medication.
So what can we do? You said pre-diabetes. What can we do? Well, first off, what are some of the symptoms of having diabetes? And then what can we do to kind of prevent from us even developing or, getting diabetes? I guess that's a good question. Does that make sense?
Yes, absolutely.
Yeah.
So the main symptoms of diabetes, initially, you probably won't have any, but the most common ones would be fatigue. You could have blurry vision, feeling hungry even though you're eating normally, or urinating excessively, especially in the nighttime, getting urinary tract infections. Your body is supposed to reabsorb glucose and proteins. It shouldn't be found in the urine. So once you get beyond a certain level in the blood, it'll start spilling out into the urine. So that's definitely for women, like yeast infections. That could be if you're constantly going to the doctor having yeast infections. We see this all the time. People that had gestational diabetes, women that have that are 50% more likely to have diabetes later in life. So, all these things, this is the answering the question about the symptoms, but then the next thing is prevention and screening. So if you know you have someone in your family that's diabetic, especially if you're overweight, you should be getting screened. So a first degree relative, like a parent, a sibling, even a grandparent is important, with family history. So whenever we, in primary care, we have a big emphasis on getting good medical history from patients. So I always ask people about gestational diabetes and their family history of diabetes.
Yeah. So does that even include type 2? So if I have a grandfather, like I said, my father was diagnosed later in life with type 2. Is that a warning for me?
Yes.
Or is it just based off his diet or your
No, there's definitely
diet?
the genetic predisposition. And that's why I tell, sometimes people feel very guilty. And there is a big stigma, linked with diabetes. But, unfortunately, minority groups are much more affected by it and at a younger age. So I've seen about 55% of my patients are African American. So there's much higher incidence of high blood pressure, stroke, diabetes, high cholesterol. And when you have diabetes, unfortunately, you're much more likely to have those other associated conditions, such as high blood pressure and high cholesterol. So the biggest thing people can do is maintain a healthy weight, be physically active, and not smoke. Smoking is hugely tied to the risk of heart disease. What happens with diabetes, there's a lot of microvascular complications, all the small blood vessels and large blood vessels, but it starts with small blood vessels. That's why neuropathy is a common presenting symptoms, like numbness and tingling of the hands and feet. So that's a common thing. People come in. That can also be caused by alcoholism. Like if you drink heavily, you can
Yeah.
have vitamin deficiencies that can cause neuropathy. So we usually screen for all of these things. There's a lot of discussion and just talking that occurs, like at an initial primary care visit. But I think not smoking, maintaining your weight, and being active, just exercising 3 times a week hugely decreases your risk of diabetes. So we all need to get moving. So with our society, we eat too much carbs and sugar. So there should be much more emphasis on healthy foods and access to healthy foods. There's a lot of pockets in the United States where they have like food disparity. There might not be, if your only option is the dollar store to buy food and there's no fresh fruits or vegetables,
Right.
that's a huge problem in our country.
Yeah. And I think that's why we often, and of course, we're going to break everything down, why we see all of the disparities, particularly in minority communities, attributing to diabetes diagnoses. I want to bring in Antoinette. I want to bring in Antoinette right now because you mentioned, Dr. Syed, how a lot of people are diagnosed at a young age. And I know that was the case for Antoinette, diagnosed at a young age. And I think I said type 1. I want to make sure I got you right. Are you type 1 or type 2 diabetic, Antoinette?
I am type 1.
Okay, so I was correct. Okay. And so tell us a little bit more about your diagnosis, how old you were, and how you all came to find out that you actually had diabetes.
So I was diagnosed in 2006, and it came from, we found out that I was diagnosed through frequent urination at night. After being 6, it'd be normal to see that someone's potty trained in there, going to the bathroom normally. And I went a long period of time of using the bathroom on my own, and then, waking up in my sleep in the middle of the night, using the bathroom, or even getting to the point where I wasn't able to, hold it overnight. And I was just peeing in my sleep, which was like a huge sign for my parents that something was wrong, because I could not hold my urine for anything. I was drinking lots of water, constantly tired, sleeping a lot. And at that point, we ended up thinking that I had a urinary tract infection, and went to the doctor for a urinary tract infection and was told that I was type 1 diabetic after they tested my blood sugar, and they did a urine test as well.
Wow. And that was at 6 years old.
Yeah.
Wow.
Talk about some of the challenges growing up dealing with type 1 diabetes. I mean, birthday parties, cupcakes, classroom candy, Halloween. You had to stay away from that. Is that correct?
I had to stay away from
limit
it.
yourself. Yeah.
Yeah, I did. You definitely, I think, growing up with diabetes, there's always the big question of, can you eat that? And the answer is yes.
Set the record straight, period.
But the answer is yes, I can, and I actually will.
In moderation.
In moderation.
Yeah,
It's really about like management. I think that's a big struggle that I dealt with growing up, of just communicating with people about how to manage it and how they were able to assist me in managing it. Also communicating with my doctor, doing sliding scales, which is basically when a doctor helps you write out how much insulin you should take for the amount of carbs that you take in. So every time you eat food, you don't have to take insulin. Your body calculates it. The beta cells break everything down and break the food down for you, so you don't have to give yourself insulin, versus someone who's type 1 diabetic. We have to physically do the math based off the sliding scale our doctor gives us, and take insulin for the amount of food that we eat at every single meal, or even every single snack if there are carbs in the snack, which is a lot. It's a very tedious disease, especially for someone being diagnosed at 6, taking it all the way through high school. It's an extra responsibility for sure.
Yeah. What does that do to you, your self-esteem, your mental health, being a child in a room where you probably feel like the only one?
It caused a lot of mental battles for me. My confidence did have to go through a couple phases of redevelopment and just finding a community. Hence why I started Diabaddie, because it's hard to be the only person living with the disease, and then on top of that, you're dealing with the stigma that comes with it and the stress of maintaining it, and you have no one to talk to about it. So, for me, high school, I tried my best to do what everyone else is doing, fit in, manage my diabetes, go to the nurse, but it's still the fact that I had to step out of class or step out of what I'm doing in my normal routine to match everyone else and still keep up with my diabetes and not let it be, physically known or visibly known that I was having to take care of something else. And so I went through a huge hiding phase for a long period of time
Yeah.
until I got more confident with it towards the end of high school and started being a lot more vocal about it.
Okay.
People knew, it just wasn't something I was like super proud of or happy to tell you if you didn't need to know.
So, Antoinette, you talked about managing the diabetes at a young age. Let's talk about the stress they probably put on your parents as well. What was their take on it when you were diagnosed?
They had to learn a whole new way of managing their child. I mean, childcare is extensive in and of itself. I'm not a parent, but I do watch I do watch parents from afar, and I know, keeping up with a kid, it has its up and downs. But
Yeah.
when you're in a whole chronic disease, it's another thing that you have to guess what's going on. And so they had to end up communicating with the doctors. Thankfully, so I had the opportunity to go to diabetes camp shortly after my diagnosis. So I actually learned how to give myself a shot, count my carbs, and communicate to someone how to help me with my diabetes management, because I did have that diabetes camp experience. And that's why Diabaddie does work to fundraise scholarships for children of minorities who go to diabetes camp, because that experience was really a huge part of my development with diabetes. And I think it helped my parents out a lot too, because I came home knowing what I was doing.
Yeah.
awesome.
Yeah. And I mean, I think it's one of those things where Antoinette actually knows my family friend. They are family at this point. And so she's like my niece. And she is 14 years old. She got her diagnosis. Correct me if I'm wrong about Maurice. Antoinette, was it 3 years ago at this point or 2?
3.
I think it's been 3 years. And so 3 years ago, we all find out and we are like,
Wow.
what do we do? And it's literally, you have to start from scratch. Like what Antoinette said, like the parents, the community around the child, right? Because if I'm taking Maurice and Ariana and her sister out, I got to know what to do when the things start beeping. I have to know what to do if she's high or if she's low, or, or else they're going to be blowing my phone up. And so it's one of those things, that shock factor initially for families and for immediate friends who are around, especially children who get diagnosed. And I think, Antoinette, what I see in even Maurice is at now, and Dr. Syed, you can talk about this, the patch. Why can't I think of the name?
It's
Continuous glucose monitor.
Continuous glucose monitors. Yep.
Yeah. And so it's visible. And when you have to change your pump and all of those things. So imagine being an 11-year-old girl in middle school. You're about to go through puberty. You're changing. Social media is a huge factor now. And now you add this physical appearance, this altered experience to your appearance because you have diabetes.
Have you seen some brands started listing that in their ads, like people with colostomy bags, glucose monitors? I mean, I think that's awesome for kids that are,
you're starting to see
obviously
more.
It's a lesser population, but they're represented.
You're starting to see more commercials on those the CGMs, and we just ran a video for those who are listening. We just ran a video of just showing the finger pricking, which is a thing of the past somewhat.
That's what I knew. I grew up, there was a girl in my class through middle school who had diabetes, and that's what we knew. Like Maria would be over there, she'd be tapping her finger, doing the blood, or like having a snack and things like that. But I don't see that often anymore.
It's still,
I started.
Unfortunately, a lot of insurances, don't cover it. And there are a lot of people who don't have insurance, and it's very expensive, so hopefully there are programs, to help people get, especially with type 1, there's definitely organizations to help, especially for children. And thankfully, at least here for children, there's a lot of like Medicaid and public funding. But I see a lot of people with type 1 diabetes, once they turn, adult age, like they don't have the resources, and they took years to reform, the cost of insulin. Now there's caps like on insurances. The copay is not allowed to be more than $35, but our insulin is at one point was 10 times higher than other countries, other developed countries.
Are you serious?
Yes. So it's a huge issue, and definitely with type, I see about 50% Medicaid, my patients. So, 90% of diabetics have type 2, so Medicaid doesn't cover a continuous monitor. So that would
Wow.
be hugely helpful for people to have an idea of like how they respond to food, what their trends are, how
Yeah.
even in the nighttime. I mean, you can only check, they will only give you so many strips in a month to check your glucose, but that will alert you while you're sleeping if you're having a rise or fall, so that you can adjust your medication,
My
or if you're on
goodness.
insulin. So I hope in the coming years there'll be wider access for that.
We'll see some difference there.
Yeah.
Antoinette, did you say you started off with the finger pricks?
Yes, I did. I
Wow.
started off in finger pricks. I have been through every phase of one of the first glucose monitors or constant glucose monitors, which is Dexcom. And I started with G5, went to G6. Now they have G7. And there's many different components. Some of the old constant glucose monitors used to have transmitters. Now we've gotten to a point where the transmitter and the sensor are all in one. And even with the constant glucose monitors, everyone doesn't have access to them. And I didn't have access to them at first. I learned about it later on, probably when I was like maybe 14. And even adjusting to that, I think the comment you made about Maurice is just putting one on your body in a place that one is approved for you to put it so that your glucose readings can be accurate, and also being confident about wearing it out, and doing it in a space that you're okay with other people seeing that it's on your body and asking you potentially, okay, what is this device that is on you? So
Now, Antoinette, do you wear yours where it's visible to the public?
yeah, I wear mine on my arm.
Yep. And is it a conversation starter?
It is.
Yeah.
I think now that I definitely feel in my heart that I am a diabetic and know that,
Period.
I don't have a problem discussing it now, but it took a couple of years.
It took a while. It took a while.
Sure.
Yeah. I've seen that growth in our mutual friend like 3 years ago. No. There's no way you would ever see her monitor, her Dexcom. But now we were out a couple weeks ago and she just had it all hanging out. I said, well, okay, girl. Like she is just, it's incredible to see the growth. But you all were talking about the financial piece behind this. And I think that is something that's awful, because when we look at disparities, and we do have some statistics that we can discuss and pull up for those folks who are able to physically watch this episode right now. But you look at a country, a nation that's 32 million people diagnosed with diabetes, 38.4 as of 2021. My goodness. But then you look at the fact that it was the 8th leading cause of death in the United States in 2021. You break that down even further, and in 2019, non-Hispanic Blacks were twice as likely to die from diabetes compared to a non-Hispanic white person. When we hear these statistics and we see how this is disproportionately affecting minorities, African Americans, is there a real answer to why?
There's a lot of genetic association with a lot of illnesses, so I think but there's also a socioeconomic piece to this. So I think it's more linked, there's both. So, the food insecurity, all the social determinants of health, education, so much behind this, and just like access to screening. So even with STDs, I mean, unfortunately, African American women right now are the highest group affected by new HIV cases. So just offering screening, I mean, I screen all my patients unless they decline. We used to have to get permission to screen for HIV, but that's something that should just be a normal, basic part of like a yearly physical. So doing all these things, having a discussion. I work in a facility that is primarily mental health, Grace Point. So we have a lot of patients that are on medicines that increase your risk for diabetes. So most patients, I don't even discuss it. We just test them every year anyway because they're at higher risk. So I think a lot of, there's more than one piece to that, to answer your question.
Yeah, I feel like it's one of those things where it sucks. The reality of it is it's terrible, because you bring up food insecurity, right? And we look at diabetes and diabetics and we talk about eat healthy, work out. But the
If you don't have
example that you
access to
gave,
that.
correct. If
Yeah.
you are in a space and in a place or in a community where you can't get access to healthy foods, or maybe the nearest gym, even though, yes, we can work out in our homes now, or et cetera, but if the nearest gym or the nearest class that makes you feel comfortable and confident in working out is all the way in downtown Tampa, and you're 45 minutes away from downtown, and maybe you only use public transportation, all of those factors then play a role and play a part in the fact that we're seeing these drastic disparities.
Yeah.
And it's awful.
If you live like on a fixed income, people who get Social Security, they get the check at the beginning of the month, so they might buy some groceries, but towards the end of the month, they're much more likely to be eating processed canned foods that are high in
because it's
sodium,
cheaper.
or
Right.
fast food.
Yeah.
So there's a McDonald's on every other corner.
Right.
I mean, and our advertising, they've done an amazing job with making people, but that's really something that you should only be eating once a month, if at all. So this is definitely the food and activity is a huge piece, as well as genetic predisposition.
Now, there is a buzz that type 2 diabetes can be reversed. Can you elaborate on that a little bit more? Or is that true? Or
Yes, it is true. So, once someone is diagnosed with diabetes, we definitely don't want to remove that diagnosis. Say, for example, with like insurance billing, if somebody gets to a normal A1C, the hemoglobin A1C is the test that we use to monitor like the average of what someone's glucose level is. So you've probably heard this, discussed a lot. Once you're diabetic, the goal is to have your A1C under 7. And you can definitely get to that point with type 2 diabetes to even be in a normal A1C, like in the 5s, but you're still technically considered to have diabetes. You're just under control. So you don't want to like remove that diagnosis because you still want to do all the associated health screenings.
Yeah.
Someone who's diabetic, a lot of people don't realize they should be definitely having regular healthcare exams.
Yeah.
They definitely need to have yearly eye exams. Like I said, that's the most common cause of blindness. So you have to have your retinal screening. That's what we call it. So also foot exams. Definitely people are much more predisposed with diabetes to have foot infection because of the vascular complications. So once your circulation is being affected, you're not likely to feel like if you step on a rock or you're injured or something, so daily the patient should be checking their feet every day and seeing if they have any changes, any infection, nail fungus, very common. So the foot exams, eye exams, urine exams, we want to screen for kidney failure.
All of those are important.
Diabetes and high blood pressure are the most common cause of kidney failure, and they often come together. So once you have diabetes, the parameters that we want your blood pressure to be are much more strict. So it's funny when someone with any health problem, they you ask them what medical problems they have, and it's kind of like a joke because they say none. And then when
Yeah.
you see their medications, like, well, what do you take metformin for? What do you take lisinopril for? What do you take Lipitor? So they often all of those things come together.
Yeah. We were talking about education, and I want to get to Antoinette and the incredible work you were doing with your Diabaddie organization. And you mentioned as a part of your story, Antoinette, you think the biggest thing that was really key after your diagnosis at 6 was the fact that you went to diabetes camp. So we talk about how these diagnoses come at such a young age, right? But if the parent can't afford to send their child to diabetes camp and be able to learn how to give themselves a shot and be able to learn how to count their carbs and all of those things, that also contributes to the disparities that we see with this disease. But we're so grateful to have organizations like Diabaddie working to raise funds to send children to diabetes camp so they can get that education. So talk about how that actually fostered the fact that you wanted to create an organization and a platform like Diabaddie.
Well, I think for the most part, diabetes camp is the reason I am able to confidently talk to others about having type 1 diabetes, because I knew immediately after being diagnosed that I wasn't the only one in the world. I might be the only one at school, but I'm not the only one in the world. And so I had something to look forward to every summer, to go to a place where I knew everyone around me was going to have type 1 diabetes and be having the same experiences I was, and that I was also going to learn on how to manage my diabetes better. I think diabetes camp also played a great support in my mental health as well with type 1 diabetes, because diabetes burnout is very, very common, especially amongst minorities, because of the things you guys just discussed, of just the barriers to getting support, barriers to even getting to your doctor's appointments, or discussing with others that you have type 1 diabetes or type 2, if that's your case. And so the diabetes camp experience really just cultivated that support system that I needed, and also helped me just really know how to manage my diabetes, like giving myself a shot, taking insulin, telling somebody else how to give myself a shot, counting my carbs. All of those things are really important in management, especially for a kid. So
Yeah.
Now, Antoinette, tell us a little bit about your background. Through diabetes, you then went on to college, and if I'm not mistaken, are you a nurse right now?
I work as a diabetes navigator at
Yeah.
Johns Hopkins, and I do specialize in underserved patients. And we work on their access to diabetes technology.
And so,
Wow.
I mean, other than being diagnosed at 6, what kind of motivated you to go on and pursue this career?
I just didn't see enough people in the diabetes space that looked like me, especially with the
Wow.
development of social media over time. I did not see enough people that looked like me, that had the same skin color as me, um, dealing with diabetes. And I think that's really important, especially for the minority communities. There's just some things that we experience internally, and it's important to be able to reach out to someone else that has that same experience as you, or can help you navigate that experience. And so I created that community for myself, and I've seen it be helpful for other people too. And I hope that we can
Yeah,
continue for it to be helpful as well.
We are so proud of you.
absolutely.
We are so proud of you for even creating that platform, going into that field, being that representation, being rooted in progress. Hello for the plug. And with Diabaddie, talk about the impact you've already had, because it's still technically a fairly new organization.
Yes, it is fairly new. We have tons of ambassadors now. We have a lot of different students at different colleges that are um, young minority women with type 1 diabetes that are advocating for children, both male and female, to go to diabetes camp. We even are working on getting some of the students to a diabetes camp, because we have that diabetes can be diagnosed at older ages as well. I know a lot of people expect for especially type 1 to be juvenile, but it's been recent that a lot of people have been getting diagnosed in their early 20s, even 30s. And so we have people who have never even gotten to experience diabetes camp. And so we are just within our community communicating about how impactful diabetes camp is, and how impactful it is to have someone else in the room that looks like you, or someone else to talk to that looks like you with type 1 diabetes. And they connect on social media. We have like over 1,000 followers on social media. We have done events in the past, and it's just fun to see someone else, and be able to talk to someone else, and build a friendship out of it. Like all the Diabaddie girls, they communicate with each other like friends, like sisters, and we really, really, really take advantage of having that community together.
And for those wondering, like, how did we get this name, Diabaddie? Because I think while the question might sound silly, it's really an empowering thing, with you creating the organization and coining it and terming it Diabaddie.
I mean, I believe I'm a baddie with a broken pancreas. I think, you know, it's really as simple as that. I know I look good. I'm very confident in who I am and how I developed, and I don't want me having a chronic disease to take away from
Yeah.
my own personal beauty. So I am a diabetic because I am a baddie with a broken pancreas, and that's just that.
Wow.
Well, let me go back to your history a little bit.
I love it.
And
I love it.
Dr. Kathryn, you could probably weigh on this. But Antoinette, is there anybody in your family that's a type 1 diabetic?
No, I'm actually the first to be diagnosed
Wow.
in my family, but I do think it's important to get screened, and I definitely am looking into talking to my parents about my younger siblings and cousins getting screened for type 1 diabetes, because we have the technology nowadays and the test to run to
Yeah.
test for antibodies and look at how long out you might be experiencing a chance of being diagnosed with type 1 diabetes. And there's even, I think, medicines nowadays to prolong the diagnosis. And so those are advantages that I did not have. I'm sure if my parents could have got a screening, you know,
Yeah.
at age 3, that I was going to be diagnosed around age 6, they would have prepared a lot differently. They would have probably been able to get educated a lot more. And so if you are interested in getting screened for type 1 diabetes specifically, or type 2, you should definitely do it. I do recommend that, because if you can learn early, and beat the barriers and the mental struggles beforehand, then please, all means.
Yeah, Dr. Syed, how does one go about that? Is that just a conversation with your doctor, your primary care, or what does it take to just get a screening as far as, I guess, so would that be like for your glucose levels? Break
Yes,
down what that
that's
screening is.
The initial screening is usually either a random glucose or fasting blood work.
Okay.
So that can just be checked on routine blood work. There's, like I said before, the 90% is type 2. So that's much more different. And we definitely look in primary care, we're seeing a lot more, obviously, of type 2. So for type 1, there is not a specific screening. It's not genetically predisposed, and we don't know the exact cause. It's thought to be something linked with the immune system. So maybe you have like a virus that triggers, but there is definitely a lot of more cases of people that are older developing type, so if there's not, especially if you end up with something like diabetic ketoacidosis, so that's a much more higher risk complication where you have like problems of the acid-base balance in the body. So some people don't get diagnosed with type 1 diabetes until they have like a life-threatening hospital admission.
Yeah.
So that's usually how they figure that out. Definitely with kids, like bedwetting, problems with urinating when they already were potty trained. But for the average person, definitely talking to your doctor, seeing what your risk based on your weight and family history, and asking for just routine blood work.
You bring up family history. Now, if somebody has a grandparent who, say, had type 1 or type 2 diabetes, how at risk are you?
Well, we look at really first degree relatives. So that would be like parents and siblings would be the most important. But, definitely grandparents are important too. With genetic history. So I kind of, over half of the population is overweight or obese. So I really kind of screen all my patients. I don't really, because
everyone's not a great doctor, Dr. Syed. My goodness.
I see a much higher minority, between like African American and Latino population. So definitely there's higher incidence, even with, like Latino people, more likely to have fatty liver, cholesterol problems.
Yeah.
They're more likely genetically to have like low HDL. So HDL is like what we call good cholesterol that prevents our body from storing the bad parts in the arteries.
Yeah.
So if you can kind of educate, on the importance of the weight and the diet, that's the biggest impact if you can find that early. So a lot of my patients are younger age, so I definitely stress that.
And I joke, sorry to cut you off, Terrence, but like I joke about like everybody's not a good doctor, and it's not necessarily a good doctor, but not every doctor listens. And I think to Antoinette's point, when you feel like you have a doctor who has either worked in your community, looks like you, or has the same experiences as you, they're more prone to listen and sympathize with what you might have going on, because then you oftentimes sometimes go to the doctor, right, and you say all these things, and they're like, "Oh, girl, you're fine. Just go ahead.
Go take
You'll be okay.
and come see me in a few weeks
and come back, and we'll do a follow up." But really, like, imagine if Antoinette went to a doctor and they just said, "Oh yeah, she's had a few accidents, and oh, it's okay. She's still young.
Yeah.
It'll be all right." You know what I mean? And so it's hard to find that representation even in the medical field. And so that's what I love that Antoinette has taken it upon herself to say, I don't see a lot of people who look like me, who can be an advocate, so that we can avoid that from happening again.
Well, you used the word advocate. We have to advocate for ourselves.
Yeah.
Our body, we just have to listen to our bodies. And, going back to what Dr. Kathryn said about just what do you feed your body, what your diet looks like. And, if you constantly keep having those headaches, or as Antoinette said, constant urination, fatigue, something's going on, go get checked out, and don't let a doctor sit back and tell you, oh, it's nothing. I have a physicals once a year. And so my question to you is, Dr. Syed, is when I go to my doctor to get my physical, what do I need to make sure I A, look for, and B, ask when it comes down to those screenings and those numbers?
Just make sure they're doing what that would be checked. You can ask for a hemoglobin A1C test and a metabolic panel. So the metabolic panel includes your liver and kidney function and your glucose level.
Now, how come that's not included? You would think that's included.
It should be. I mean, if you have anything we do, we're looking at preventative care. So, like this is a huge thing with with the United States that we're trying to focus on where they don't do in a lot of other developing countries. So there's specific things for both men and women depending on the age, like pap smears and mammograms for women, colon screening for both. So there's a lot of things that people don't really want to address unless they're having a symptom or a problem.
Right.
So that colon screening is always the one that we kind of fight. And I say, well, this affects my scoring. So would you do it for me if you don't want to do it for yourself? Like would you consider? And sometimes that helps get the testing done. So, but I definitely think that should be included for all adults, especially if you're over 45, to be tested for diabetes.
Yeah.
Wow.
That's me.
Not you showing your age.
I wouldn't have guessed.
Yeah, that's me. I'm not ashamed.
Antoinette, do you have anything going on with your organization that the folks listening can either support in some kind of way or attend coming up?
We are currently fundraising for diabetes camp right now. The summer is right around the corner. I know Thanksgiving is in a few weeks, but before you know it, we'll be getting prepared for the summer and the new year. So we have a couple fundraising campaigns coming up in the spring, and we're going to be posting that via our social media handles. So you can follow us at Diabaddie.org on all social media platforms to check out when our next events will be coming up. And we also have a panel discussion coming up on November 26th. So you'll be able
That's awesome.
to do that.
So
Yeah.
what is the age range, Antoinette, of your camp or for the camp?
The age range for diabetes camp is typically 5 to 15. And then there are some older age camps that go from 15 to 18. I did personally grow up going to diabetes camp Winona. And I went to camp all the way until I was 15 years old. And then I graduated and went to another smaller camp for 18-year-olds.
And for our audience, the camps are held where?
There's camps all around the nation.
Okay.
The American Diabetes Association does a really good job of listing out all the diabetes camps on their websites. I know in Florida, for all the Tampa people, Florida Camp for Children and Youth with Type 1 Diabetes is in the Tampa area. They do camps even at USF's campus for the diabetes sports camps. They have a Rotary camp in Brandon, Florida, and they have Camp Winona, which is more so towards the Orlando area. There are camps all around, but definitely would encourage anyone to reach out to us. We can definitely direct you towards a camp that's in your area.
Great.
Awesome. Incredible work. We're so proud of you, Antoinette. Thanks for joining us and hanging with us and sharing your story and the great work that you are doing. And Dr. Syed, I have to give you your flowers.
Absolutely.
Thank you.
Thank you
for what you are doing in our
Pleasure
community.
to be here.
Because well, yes, thank you for being here, but more so really what you're doing in our community. Because it's hard. It's hard to trust someone that you advocate to, you know what I mean? And so to know that you are there advocating on behalf of so many people and a large part, that's the minority community, we greatly appreciate you and being here in our community and doing it.
I love it. I've always worked in community health, and I actually, during medical school, my son was born. He's 17 now. And I went to school actually in the Caribbean, so I had Medicaid to have my delivery. And I kind of vowed at that time with, some of the things that I experienced myself, I just always said I'm never going to not see somebody because of not having insurance or having like a publicly funded insurance. And that's how I got, into the community health world. So definitely, if you're concerned for diabetes, please talk to your doctor. If you don't have a doctor, I'm here in Tampa. You can go to our website, gracepointhealthcare.org. We do see a lot of major insurances, Medicaid, the Hillsborough County Health Plan. And if you don't have insurance, you can still receive care. We have a lot of options for patient assistance programs with medication, including insulin. We operate under a sliding fee scale. So if you don't have income at the moment, your visit would only be $12. So that's huge. A lot of people just don't go. They don't get tested because they don't know where to go. But there's definitely a lot of places in our community, and we kind of just need to spread the word. Like you should be able to pick it up early if you have pre-diabetes or you're at risk and get screened for it.
And you're at Grace Point. Where's that located?
It's in Seminole Heights. My location is 5707 North 22nd Street. So it's right by Irwin Community College in Seminole Heights.
So after listening to this podcast, y'all ain't got no excuse.
Our phones are going to blow up.
Y'all have absolutely no excuse. We have two amazing resources. Can we toot our own horn,
Yes, there you
Terrence?
go.
We have two amazing resources. If you have a child that needs to go to diabetes camp, go to Diabaddie
Go to
organization.
Diabetes, yes.
If you need a checkup, if you need a doctor, you need someone on your side, we have Dr. Kathryn Syed. So we appreciate you
Yes.
both for joining us and having this important conversation because it is something that unfortunately is disproportionately affecting the minority community. And we want to make sure we're speaking on progress,
Yeah,
moving the
absolutely.
needle.
Absolutely. So again, like I said earlier, guys, you have to be an advocate for yourself.
Yeah.
Listen to your bodies. So we just want to thank you all for tuning in. And Deanne, take it away.
Well, Terrence, before we go, I do want to say, like, I think the big takeaways here for folks listening and our viewers is just your health is so important.
Yes.
No matter what you look like, whether you're brown, whether you're black, whether you're yellow, whether you're white, it really doesn't matter. And we have to advocate for ourselves and we have to try to prevent. And so there are so many resources. Make sure you all are educating yourselves on those resources, whether they be local, whether they be at the state level or even at the national level, because that is how we all come together and truly make progress and make sure we're kind of, punching away or kind of inching away at these disparities that we see.
Right. And just knowing that Thanksgiving is around the corner, and you heard Dr. Syed say that, diet is a big component to type 2 diabetes for sure. So we want to make
But
sure.
that's one day, too.
Yeah, but it's the
Let us
entire
have-
weekend.
Don't take the joy away, please.
Let
Yes.
us, come
Listen,
on now.
It's not just one day.
Let
Because
me have my
you cook all that
greens,
food.
beans,
You,
potatoes,
you're going to eat that all
yams,
weekend.
ham. Please. Please,
If,
just once.
if you're going to indulge.
Just go get checked afterwards.
Yes, absolutely.
Period.
Or before.
Or
check
before.
Yeah.
There we go.
There you go. Get your pre-diabetes check before, so you know what you can eat.
And then get
the
back on
day
track.
of.
There
Yes.
you
Get
go.
back on track the week after.
Then afterwards, go through a fast, a detox, and you should be okay, right, doctor? So, but, man, this is great. Absolutely.
Yeah. Well, hey, we're here every Thursday, 11 a.m. Make sure you join us for Rooted in Progress. We're live on the WFLA Facebook page. Download the WFLA app. When you download the app, you click the live button and you can join us live from the app as well. We send you a push alert. But then you got to follow us. You got to add and subscribe to Spotify, Apple Podcasts, and then we will re-air this episode and it will be posted on YouTube as well. So as always, stay rooted.
Stay rooted, folks.